type or appropriate type of vehicle. So you have to check the in order for you to know how much calories. So usually sa dietitian naman na talaga yun. But at least you have the knowledge, so you should familiarize. So ano ba yung concept mo? Yung formula na pinipila sa pasyente. So each patient has different diet. So depende sa calories, what type of diet. So you should always check the doctor's order for the appropriate type of the diet for your patient. Then you have to send the requisition to the patient. For example, you have to check how many calories or what will be the amount to be given to your patient. Then you have to send to the kitchen or request so that the dietitian will prepare or provide a set for sila. And then, you have to check early to ensure the formula is already available. So, hindi ko pwedeng, let's say, ang normal na pagpapakain sa patient that is 7 a.m. Tapos 7 a.m. makakalang pumunta doon. So, at least 30 minutes before the meeting time, you have to check early to ensure that the formula is already available. So, if the formula is already available, let's say it is refrigerated, you have to warm it. So, you have to warm the formula first into its temperature using 3 pm hot water. So, ganun na kasi pag nilagyan yan, napaka-activate yan. Malapot na masyado peaceful. So, malapot masyado. So, you have to warm it using hot water. And then after that, so you have to gather or prepare all the necessary materials for feeding. Of course, you have to prepare the tray, then the formula, and then you have to accept the syringe, and then everything with water, and then we have the stethoscope. Nakakala ng baso doon, isang baso na lang. So, the formula, then a glass of or cup of water. Then, if there's medication for the patient, so also you have to prepare the medication. Then we have a medicine cup. Then we have the clamp. So, meron talagang clamp for this gamit. So, kaya lang, just show you lang how this clamp is shoot. Okay, so after preparing all the materials, so for the procedure, always check the physician's order for the type, amount, and type of feeding. So, what type of feeding you're to be given to the patient? What will be the amount? What will be the amount of the formula? And then what will be the time of feeding? So after checking the physician's order, then you now wash your hands, and then go to your patient. This is self. So go to your patient's unit, and then introduce yourself. Identify your patient, no identification bracelet, link of the patient to the headboard or the foot part of the event. And then introduce yourself. So good morning, good afternoon, sir. I'm San Pedro. I am a patient for today. And I'm here to assist your schedule through NGT. So you have to explain the procedure every step of the patient operation. And then gather all the study materials. So again we have these say the formula, accept the syringe, the stethoscope, syringe, and breathing a cup smaller than the medication is indicated. So, gathering all the necessary materials will save time and energy for the caregiver and smoothly carrying out of the procedure. Then, after that, we can now check the position of the fluid in the correct position. So, we have 3 ways in checking the tube for its position. So, first is you have to position the patient in the semi-powdered position. So, in the hand of the bed, so positioning the patient will prevent the patient from aspiration. Okay, then you can now check the tube for its correct treatment. So first is aspirate the stomach content of the patient using a septum syringe. Okay, so after aspirating it, so the tube is in the stomach of the patient if the stomach content can be aspirated. So how will you know if the stomach content? So what will be the color? So it could be green or yellow. So greenish. So pag aspirate kayo, yung content ng patient, meaning this will be the correct position. Then next procedure. So you have to inject at least about 10 ml of air. So using again this syringe. Then simultaneously, while injecting the 10 ml of air, you have to aspirate the patient's stomach. So upon aspiration, you will hear the whooshing sound. So you can hear a whooshing sound. So meaning that tube is in the correct or the patient's stomach. Then the last one is, so you can put the tip of the tube to the edge with water. So bubbles did not appear, meaning this is the correct treatment. That you should know that sometimes this procedure is has disadvantage because sometimes bubbles did not appear because maybe for the sparring. But if your bubbles appear, so meaning this is the respiratory tract of the patient as the patient exhale as a treatment interval. So it should be held nasa respiratory tract siya. So those are the 3 ways in checking the tube for its correct treatment. So after checking the tube, so you can now proceed to the destination. So select now the accept syringe to the NGT tube. So be sure that the accept syringe should be above the level of the head of the patient. So this height will facilitate the pressure of the authorized foot para mas madali siyang bumaba. And then pour at least 3/4 full of the formula to the septum syringe. So 3/4 full lang. Sa pwedeng full-in. Bakit kasi yung mangyayari? Hindi na bababa yung authorized food kasi wala nang pressure sa loob. Diba? So, dapat at least 3/4 full lang. And then, after giving the formula, so when the patient of the given formula, you can now give the water water for the patient. So 30 to 40 ml. And then, after that, so you have to clamp first the tube. Then if medication is indicated, so you have to put the medication. So kung liquid siya, walang problema. So all you need to do is to measure it. Pero kung haplo siya, anong gagawin mo? So siyempre, diba, you have to dilute it to the
medicine.
yes. So you have to dilute it first, and then again select the remove the clamp, select the accepted syringe, and then take the medication. Then you can give another water to flush the medication and the remaining food to the accepted syringe. Then after giving the medication, so remove the accepted syringe. Then clamp the tube. So we clamp the tube to prevent accumulation of air. Okay. Then you have to wait for at least 30 to 60 minutes before repositioning the patient. So you have to turn first the patient's head to one side to prevent regurgitation of the food or vomiting or the backflow of the food. Then after 30 to 60, you can reposition the patient into a lying position. Then afterwards, so you can now, after care all the materials, wash your hands, give the patient comfortable, and then make a documentation or report to your nurse or